Is a MD PhD. In addition, he has also degrees in business administration and law. In 2008, he was nominated as the director of the General Hospital at the Tel Aviv Medical Center, and in 2010 he became the Director General of the Ministry of Health of Israel. Professor Gamzu.
I hope you can hear me, so I can move away from the stand. Thank you for inviting me for giving this lecture. I'm giving this lecture on behalf of the Ministry of Health, and I will try to summarize in the 20 or half an hour, 20 minutes or half an hour that I'm allowed to say what is the role of the government in health promotion and preventive medicine. What is the role of health ministry around the world in promoting health and putting forward a national scheme, a national project in order to advance health and prevent diseases. Indeed, in 2011, the government of Israel in November has put forward a national program to promote active and healthy living in the state of Israel. It was a joint program of the Ministry of Education, the Ministry of Culture and Sport. At the center was the Ministry of Health. And we put forward that program, and a lot of challenges are in front of us, and we'll try to elaborate how do we come to do that and what are the challenges ahead. First, let's look what the World Economic Forum has said in 2009 regarding global risk all over the world. All over the world, they put a lot of issues at risk, but they put two risks which has a very high likelihood and the severity is very high. And one of them is the fiscal crisis that we are all facing now with austerity situation all over the world. But the second one is the non-communicable diseases all around the world. It doesn't matter if you are in a Western country or another part of the world, you will face non-communicable disease, a chronic burden of diseases, huge burden all over the world now, and of course 20 years from now, more and more. And this is the reason why every country has to invest in that. This is the reason why every country has to put resources and put national plans ahead in order to put this challenge and to confront it. But of course, many of the economies around the world now are facing austerity crisis and fiscal crisis. And when we are looking at the healthcare systems around the world, we see increasing expenditures. The reason for the increasing expenditure mainly is aging all around the world. And if we look at Israel, Israel is number 3 in the growing pace of aging around OECD country. Number 3, now we are about 10% elderly, more than 65 years. We will reach about 14% in 20-25 years to come, reaching an increase in the relative number of elderlies of 40%, number 3 in the OECD countries. And the next thing is the chronic diseases, the non-communicable disease epidemics, all occurring because we are not just jumping in demography, but we are jumping in the share of the elderlies in our population. This causes a huge burden all over the world. This huge burden, of course, brings with it a huge economic burden in the healthcare system and elsewhere in the economies all over the world. And there are a few other things that push expenditure high. Healthcare system all around the world. It doesn't matter where you are. All around the world are in a fiscal crisis, in financial crisis of the growing expenditures. Of course, the states leading ahead, but if you look at the OECD countries, their average now is 2-digit, is above 10%. In Israel, we are now stabilizing at about 7.5. However, we are a relatively young country, still 10% only elderlies. When we look ahead, when we reach 11, 12, and 14 years to come, we will have the same crisis on top of us. And when we are looking what are the drivers of the higher costs, first, the disease burden, of course, aging, unhealthy lifestyle. These are the drivers on the utilization side. If you look at the demand, this is on the demand side, but if we look at the supply side, still we have not put enough money, or are not putting enough money in prevention. Prevention still lag behind. It lag behind because of many very long-term effect. We are looking usually at the healthcare system around the world of the very short-term effect. It's a long-term effect. The return on investment is not here now, so many healthcare systems around the world do not put the money into health promotion and preventive effects in the time being. And the World Economic Forum this year, after a survey that he has been doing on China, the UK, the Netherlands, Germany, and Spain, reached a consensus. He was serving these countries. He took the policymakers, the opinion leaders of the healthcare system, and asked them, what are the main things that we have to invest? What we need to change? What are the most effective measures to be taken? First is data and information. The second is to reinvent the healthcare delivery system. Not just hospitals, clinics, patient to doctor. You have to reinvent that, to look and be creative, innovative, and look at other ways of providing health. But the best or the main thing that we are focusing now is to build a healthy lifestyle and living. They were focusing on that and telling countries, not just build hospital. Don't put your resources only on the healthcare arena. You have to put resources on the lifestyle. Put your efforts here. And why is that? Because if you look at environmental intervention, is almost the only cost-saving measure to be taken. It will save cost. There are other measures that have different effects. But when in regard to cost saving, if you are putting your efforts in the environment, in the way that you plan cities, in the way that you promote healthy lifestyle, you will have a cost-saving technology. So why? Why to put your efforts in that? First, no matter how efficient your health system is, you will never succeed in sustaining the healthcare system unless you will do something for the growing demand. You have to slow the growing demand. You have to sustain, to contain it, because no matter how efficient your system is, and even the Israeli health system, which is regarded a very efficient system, will not be able to handle the growing demand and the growing burden of the NCDs years to come. We are at a world that is very high-paced urbanization process, and the industrial forces are yet to grow. We are now only at the beginning looking worldwide, and even looking at Israel. We are still under a very intense urbanization process. And we know that the country itself in Israel, the cities are growing and being the dominant part of our way of living. How do you plan them? Do you plan them in a healthy manner? Or they are still cities with environment which are obesogenic environment? The emerging economies, maybe Israel is an emerging economy. We are, as I said, at an unprecedented pace. The historic opportunity is now. This is the time to look ahead and to plan our lifestyle ahead in a very clever case. Of course, this is what I was saying. And how do you do that? First, you have to influence food consumption. Again, this is a consensus from the World Economic Forum this year. You have to influence food consumption. They are saying to the government, you have to interfere. It's not a free choice. Please influence that. This is your responsibility. Of course, there are a very huge spectrum of regulatory intervention, but you must do that. It is not popular sometimes, but it is your responsibility. You have to collaborate with the industry in improving labeling. This is what they are saying, labeling of food and beverages, and encourage product innovation. You have to push the industry for the healthy lifestyle approach. And tax policies, you have to reconstruct that, because the tax policy and the subsidization now in our economies all over the world are upside down, but they should be in manners of healthy foods. Of course, then you have to promote the sin taxes all over the world. In Israel, we have only sin tax on cigarettes. And alcohol, yeah, now. Influence thinking and living. Teach children, of course, as much as possible about chronic diseases, about their nutrition, as early as possible. Improve health literacy at every age, and influence the society on norms of exercise and nutrition. And look at that. They are saying reform city planning. Put health professionals in city planning in order to create healthy cities. Emphasize their planning on outdoor activity, on shopping habits, green area. Look at the transportation. So in order to confront, in order to put us in a good place at the challenge of the NCDs, we have to do all that. And what we are doing in Israel, we have done. First, we have to know that it's also in Israel a leading cause of death all around the country, all the NCDs. It is cancer, it's cardiovascular disease, and diabetes. They are up there and still growing. Although we are a young country, with a young distribution of the population, still these are the killers in our society. 65% of all death. Of course, the major behavioral risk factor are still smoking, poor nutrition, a sedentary lifestyle, not enough physical activities. We have to know that Israel suffers that. We are not a healthy nation as we regard ourselves. And we can see that it is a growing process. If we look at the year 2003 and 2004, about the rate or the portion of diabetes, and approaching 2008 and 2009, we can see an increase about 30 to 40%, male and females. And you put on the way of diabetes many other diseases, because they are not just a disease by itself, of course a risk factor for many cardiovascular diseases as well. So we are here. Clearly this is an epidemic in Israel. And we can see now in the year 2012 approaching 10%. Clearly epidemic. And we have done a health survey that took many portions of our society, different ages, in order to see what we are facing more than that. And of course, obesity is under crisis in Israel. Don't look the other way. We are approaching, and we will be one of the highest 10 in the OECD countries very soon. Overweight rate now in Israel is almost 50%. The overweight rate among adolescents is about 20%. Only a third of our population engage in physical activity. In the Arab sector, we have a bit higher problem in anything regarding lifestyle. High salt. We are putting too much salt in our diet, above about 50% above the WHO recommendation. And if we look at some issues or look at smoking, we are something like 20% in the Jewish community, in the Jewish population, about 50% in the male Arabs. A huge problem. It is there, and we can see it in our data. We can see the increase in lung cancer. We can see the increase of all the detrimental effect of smoking. Of course, passive exposure as well is very high, and fruits and vegetables, it's different between the Arabs and the Jewish, depends on what you are looking. Low-fat diet, again, it is different between the different population, and the low-salt diet, still about 50% of our population is a diet which is very high or too high on salt. Sedentary lifestyle, this percent are not representing, this is underestimation. It is more than that. People are saying that they are doing physical activity more than are really doing that. And the burden on the healthcare system, the economic burden is huge, estimated to be about 10 million shekels, more or less. This is about, we're taking all kind of extrapolation for other scientific data that we are having, but we have huge indirect costs. Huge, that of course it relates to the work competence, sick days, and long-term care in our society. And we have to recall that the chronic diseases, the NCDs, are preventable. They are preventable regarding lifestyle. You can use or push your society to more healthy lifestyle. And they are, by diet, fruit and vegetable, you can decrease the chance, the risk for cancer, overweight and obesity. Again, these are all measures. Once a nation takes action in that, it can succeed. She can succeed. We can do that. All over the world, this has been recognized. No matter what you are talking about, the OECD, the WHO, the United Nations, everybody knows that this is a risk, and years to come, 20, 30 years from now, it will be a huge burden on economies. It is here now, but it will be much higher, and will put countries and economies in a corner. The burden will be so high that it will affect their economies and their societies, and of course, all issues. So the Ministry of Health, in the last more or less 10 years before I became Director General, put forward a plan. It was saying 2020 Healthy Israel, and put forward actions in many issues. So we have taken the NCDs, the health behaviors, and more or less the environmental health, and wanted to make it practice, to put it into practice, not just a plan on papers. And we reached to the government after we put that in a practical manner. We put that forward that to the government, had ministries that are partner with us, that took partnership, which is the Ministry of Education and Culture and Sport. And on November 2011, we pushed legislation, or pushed a governmental resolution on many issues that pushes and makes that the responsible for the government, all the government, not just the Ministry of Health, to push forward for many legislative actions in order to confront the NCDs. The major principle, first, is commitment for the whole government. Many ministries are involved. And we have to collaborate with many national and local governments, HMOs, private sector, and civil societies. We are collaborating with the HMOs in Israel, with the municipalities, in order to push the program at the national level, not just a project of the health ministry. We have to look at the best practice and cost-effective programs, not just any initiative. Put forward planning. Money is a big issue. We went to the Ministry of Finance and told them, please budget that. This is the first barrier, because once you do not get a budget, the first intuition that you have, okay, I will drop that. They didn't give us a shekel. So this was a point of decision, and into the ministry have decided to do some kind of prioritizing and to get money from the ministry, about 40, 50 million shekels, putting that at a 5-year commitment into the program. And this is more or less about 200 million shekels program. Of course, we are putting all kinds of national and local initiatives and many legislative initiatives, monitoring the program and marketing it. Not marketing it on the newspaper, but doing that more cleverly. Social marketing, putting that in a very clever and modern way of marketing this very complex issue. And the aim is to reduce morbidity and mortality regarding the NCDs. The objectives, of course, is more people engaging in physical activity according to our regulation and reducing the overweight in Israel. How do you do that? You have to change behavior. This is the most difficult thing, the most very complex issue in health promotion. When you are speaking about changing behavior, there are many models for that. You have to understand that education and knowledge enough is not enough. Because the environment then leads you back to your old behavior. And you have to put incentives. You have to have the knowledge there, push for education, put incentives, and allow them to be in an environment which allows them, which enables them to make the change. You have to put these 3 items all together to keep them ahead and push them ahead. This is the way. It will take years. It's not only one action. We know that changing behavior in many countries that are doing and promoting health, it's a very complex issue. But pushing all of that items all together, you have a chance. So let's put the health promoting environment issue to practice and give some examples, legislations. Israel is one of the first countries in the world to put on products labeling, not just caloric labeling, but all the ingredients into the products. How do you do that in restaurants? How do you is it enough to put the labeling as we are doing that now? How do you remove junk food from the schools and make a healthy environment? You have to change the law sometimes. It is not very popular because you are intervening in the private choice. Front of pack labeling. We are doing labeling of the food product back of pack. Israel was one of the first countries in the world to do that. Mandatory back of pack. But there are evidences now that front of pack is more effective. And there are all kinds of initiatives around the world about front of pack. Spotlight, GDA, you know all that. But none of them is mandatory. So we put forward a legislation to allow front of pack labeling of 4 items as a mandatory way of labeling products. So this regulation is yet to come to the committee, to the health committee in the Knesset, and we'll be the first country to do that. We have chosen the calories, the sugar, the total fat, and the sodium to put them front of pack. And while you are doing that, you have to prove that you have really a problem in your society, and you won't get into that. As I told you before, Israel is a very high place in the overweight. Now we are below the average of the OECD. As you can see, also here we are below the average of the OECD in overweight and in obesity. But if you look at the children, we are approaching to be one of the top countries in obesity. Children are in a very bad position. This is forecasting us to be a leading country in obesity years to come. And people are more and more eating out. So it is not just labeling the product that you buy on the supermarket. What about the product that you are eating in the restaurants? In the States, almost about 50% eat out. In Israel, it's about 30% now and going up. And the food, the non-healthy food, and the more energetic, non-healthy, is the least cost, is the lowest in cost. So people, when they are preparing food in restaurants, and of course in home, we can manage, or we can forecast that they are putting the non-healthy products into our food. And the healthier food has gone up. The inflation of healthier food is higher than the increase in food prices of non-healthy food. This is fruits all over the world, and this is in Israel, the green one here. And we see that all kinds of cookies almost are at the average. You can see that as well here at all kinds of carbohydrate drinks are not even below the average. And of course, we know all about that the portion size is increasing no matter what you are talking about. It's in Israel is the same. We don't have clear data for that, but more of all is the same. And it's again another graph saying about what happened in the 70s, the 80s, and the 90s. We can see the increase in the portion size. It's a cultural phenomenon. This is a very nice graph that I took. This is saying about the size of the main dish in the painting of the Last Supper. Look, from the year 1000, if you look ahead, the size of the dish increases. It's a cultural issue. We are looking, wanting, desiring bigger portions. And this is data from the States. We can see the increase in the regular items and the larger, the supersized items. What is the caloric difference and the increase in their size? In Israel, things are happening the same. Your dishes in restaurants are bigger than they were before. Bigger and more saltier, and saltier than they were before. If I had to give you your dish from 30 or 40 years from now, then you will find a dish that is not tasty. Now you have been accustomed to a dish with more salt. And of course, we underestimate the number of calories. This is what they estimate, and this is the actual number of calories. So people in restaurants really do not know what they are eating. And while you give them information, it makes a difference. We see without the information, and after information, people are eating less calories. They want to know. Knowledge makes a difference in what you choose inside restaurants. So this is another regulation that we are putting forward. Putting and labeling caloric values in restaurants and caterings. And this is another regulation supposed to come to the Committee of Health in the Knesset very soon. So you have to intervene as a government. You have to pass and change regulations and not just let the HMOs do that, because this is their task. Trans fat, another issue. We have been given I would say, the call from the government to put forward a sin tax on trans fat. It is a very complicated issue. We will not do that until we know that it is effective around the world, because there was some kind of initiative in Denmark, as I recall, that they pulled back. So we have to look at the data and the scientific evidences in order to push forward. So this is, again, the trans fat. It's another issue that we have to tackle. Smoking. The FCTC regulation on smoking put forward to countries to change many regulations. Of course, the tax issue is a huge issue, and we have progressed the tax issue in the last 3 years in about 5% increased tax on cigarette. Of course, not just on cigarette, also on tobacco products, but it's not enough. It is very effective, the tax action. However, we have to put forward the regulation and be in line with the countries of the FCTC. And being in line meaning do two things mainly regarding smoking in public areas and the ban or the limit on advertising and marketing of tobacco products. These are two actions or laws that are already in place in Israel, but we have to promote them again and to put them in one line with the rest of the world. So we have succeeded in putting forward more regulation and limitation on the smoking in public areas, public transportation, the railway platform, and the bus stations. Gradually taking place. If you were in the railway platforms nowadays in Israel, you see that most of them, almost all of them, are going to the rear ends of the platform. And there is, all the time, there is somebody on the, with a public announcement to do so. Bus station, gradually being in practice. Hospital entrance, clinics, and outdoor areas in restaurants. Still here, we are not succeeding. The law is in place. However, we can see still that many of the restaurants are not practicing it, and we still have some way to go in that. Bars as well, we have still some kind of problem there, how to locate, how to punish, how to give the fines in this situation. Still not included, it's private cars with kids, of course, it's a very private issue. Smoke-free schools. We are on a project with the Ministry of Education on a pilot plan of 200 schools in Israel to be smoke-free. And I believe it will go forward, and we will have in a few years hundreds of smoke-free schools. Outdoor open spaces, we couldn't We didn't succeed in putting the stadiums and amphitheaters inside the ban. However, we are still pushing for that, and we will succeed. Adding to that is another amendment of the law which limits the marketing of tobacco products, which will not allow tobacco products to be advertised in daily newspapers, magazines, many other places that are now available. Increasing knowledge, what we are doing, social marketing in the national and the local levels, we are putting many resources in that, and you see that gradually happening in YouTube, Facebook, all kinds of clever marketing. We do not think that regular, classic marketing and advertising is effective. We would like to think about that and to put that forward in more clever way. Education in school and workplace, it's being handled by the Ministry of Education on the school. In the workplaces, we still do not have a partner. Healthy cities, we are in all the issues of health promotion. We have a network. We put forward now about 20 cities in our network, and we put resources, gave them resources, money, and we are doing a joint program with them in order to have each city its tailor-made program. About half of them are Arab municipalities, and we are trying to put their obligation into the project. Incentives, what we are doing in incentives. First, in the Healthy City project, we put forward money, resources, in order to push them into making their own activities. HMOs, we are giving them some kind of resources and dividing the resources, allocating the resources by the magnitude of the activity of any HMOs. You will do more, you will get more. This is more or less what we are doing, including putting professional health promoters into their HMOs, no matter where. However, it is a very gradual issue to grow. Healthy promoting schools, it's another project that we are putting forward. Budget between us and the Ministry of Education. And as I said before, syntax, taxation of healthy foods, also kind of incentive in order to go for buying more healthy foods. Advertising of junk foods to children, it's again another regulation that is being prepared between us and the Ministry of Broadcasting, and it will take place in the next year. Because of changing governments and ministers, it was halted for temporarily, and we will continue on that. There is an agreement how to do that, which is including the second channel and channel 10 and all the other commercial channels in Israel. We had a threat of putting down or adding the VAT on fruit and vegetables. We tried our best. I don't know if it is our effect that the VAT was not added to vegetables and fruit, but still we are at some kind of a risk that the government at the end of the day will do that, but we are putting our energy in order to prevent VAT on fruit and vegetables. As I said before, active and healthy cities, we are providing opportunities for physical activity, and this is all cooperation between the Ministry of Health, Education, Culture and Sport and the cities. About 50% of the municipalities are our municipality. They are getting financial support, of course, campaign smoking in the Arab municipalities it is a bit more problematic, and we are putting any kind of resources in that. And this is an example of education with the Druze community. So what is the government role on summary? First, the government has to understand that the health issues, the NCDs, the aging, it's not an issue for the Ministry of Health. It's an issue for the nation. It's a national issue, governmental issue. It's a risk for many countries. Israel stands there because in Israel we do not have enough resources. We have a very efficient health system, but we have years now of efficient health system mainly because we are only 10% aged people, and we are approaching more than that. And if we would not now interfere and put forward a project, we'll have a serious situation years to come. So we have to set the policy to lead and to years to come. How do we see our healthcare system? How do the HMOs will be active? How do we plan our cities? How the food industry is going to look in our country? We have to change the public opinion. It's a very complex issue, but we have to be there in the media, in the newspapers, in the internet, all the time, buzzing, nagging, and putting forward, educating our people, what are the risks. You cannot say that this is their own choice or private choice. Give them to educate themselves, to empower them. We have to buzz through any media in order to increase public opinion. We have to initiate many issues and to do collaborations with all the stakeholders in the system, whether HMOs, municipalities, NGOs, education, any group in the system. Listen to them, but lead. Don't listen to them and let them do the action by themselves, because you will have a chaos. Everybody will have his own project. Not all the time it is an effective one. You have to make some kind of collaboration and put them all together. There are many barriers. Believe me, I have pushed and let the amendment of the smoking laws in the Knesset. The barriers and the pressure that you get as a regulator in these issues is huge. In the food industry as well. I'm putting forward the FOP. I'm putting forward the labeling in restaurants. All the unions of the restaurants are upon me. You have to focus on the barriers and to dislodge them one by one, being very clever and pushing that forward in an intensive way. And at the last, you have to change. You have to change the environment. You have to change the way that your system, the healthcare system, is putting or allocate their resources. Changing allocations of HMOs, of municipalities, and of course of governments. It's a huge issue, but if you are doing that in a very planned way, you can succeed. Thank you all.